We acknowledge the Bundjalung people as the traditional custodians of the land on which Shaping Outcomes stands. We would like to pay respect to the elders, both past and present. Extend that respect to other Indigenous Australians present here today. Shaping Outcomes delivers specialised supports that build on the strengths and increase the abilities of children with disabilities or delays and their families. We commenced operation in the Tweed community in 1981, providing services that are family-centred and build capacity for children, families and community. Shaping Outcomes' vision and values are the cornerstone of who we are. We're proud of our philosophy as it reflects who we are. We have a vision of ensuring children with disabilities or developmental delays and their families are supported to have quality of life and are embraced by their communities. As a leader, we provide innovative and quality practices to support children with disabilities or developmental delays and their families, and thus build inclusive communities that enable children to thrive, connect and belong. Every child, family member, community member, colleague and practitioner will be treated with respect, empathy and dignity. We value the role of families in deciding what is in the best interests of family members. We believe all family members have strengths and the ability to grow. We use innovative, evidence-based practices that are solution-focused. We support continuous learning for our staff and promote working together. We commit to ensuring the well-being of children, families, staff and community. We create collaborative partnerships by offering choice and flexibility. We share knowledge to support participation, and our practices are based on each family's goals and priorities.
Working with families in the key worker role provides lots of insight into families where you work towards developing their confidence so that they're in charge of what lays ahead. And that fits very nicely with our philosophy of family-centred practice. We walk beside the family. We're not going to walk in front of them, we're going to walk beside them and work on the things that they want to do.
Shaping Outcomes services and activities are provided under the New South Wales Disability Service Standards. We respect the rights of people with a disability, their families and carers to direct their own lives. Our unique style of service has evolved from our willingness to continually review, grow and adapt to meeting changing needs. Our staff believe in providing supports that are strongly built on evidence-based research, inclusion and disability philosophies. The transdisciplinary model we have adopted is based on best practice and organically incorporates a high level of flexibility and innovation. This enables us to build a strong and collaborative service around a child and their family to meet their unique needs, provide them choice and control, and helps them achieve their desired outcomes.
I'm currently the key worker for a young mother with a young child who has very complex needs, and in the past they've had many therapy teams involved and Mum couldn't remember all their names. So when I described the transdisciplinary model, she thought, oh, that sounded good. Can we try that? And it's worked really nicely.
Shaping Outcomes provides a key worker specialist to act as the primary point of contact for a family. The key worker focuses on 5 key areas: emotional support, information and advice, identifying and addressing needs, advocacy, service coordination. Preference is placed on supports that we can deliver in the child's home, early childhood setting or school, and within the community.
It's good to look at those tough times, maybe the child who's flinging the plate at mealtime, or the dad who can't prepare tea because son's sitting there and flicking the lights on and off. So it's good for key workers to go and see those tough situations because that's where families are asking for help.
Shaping Outcomes relationships with key healthcare professionals and teams are consistently strengthened through our collaborative and inclusive key worker model.
And look, children actually live in communities, not in hospitals or doctors' rooms. And look, it's a group of professionals who I've known now for many years, and I guess we as professionals have grown somewhat over the years. We have a very honest relationship. I highly respect their professionalism, and I think it is very much a team approach.